Hey guys, welcome back to another episode of Nursing Uncharted. Today I have a very special guest with me, Lynn. And we always start this off with the introduction of asking what your passion is.
I'm Lynn Scussel. I've been a nurse since, I'm just going to say 1999 because I can't do the math that quick. I've gone down a lot of paths, but the one that I found was my biggest passion is education.
Yeah. Yeah. And I do think just with the past year of me being the host of this podcast, that has been a really common topic that comes up. And I was really excited that that's where your heart is and that's where your passion is. And we can kind of like dive into that and like why it's important and how, what you do helps the education get to the actual nurse and to the bedside. So, yeah, which is very important. And there's always that gap of how we get there. So I'm excited for you to share how you make that happen for everyone. So been a nurse since 1999. I know when we spoke before, you've had a lot of different backgrounds. You've worked in a lot of different areas, but what do you feel is your favorite area you've worked in?
I'd have to say it's very untraditional, but my favorite area was correctional nursing, which was I worked in a super maximum security prison in Connecticut. Part of the reason I got into that is because I was always interested in forensic nursing and sort of like crime scene investigation kind of stuff. I always found that very fascinating. And my mom, who's also a nurse, she actually had a friend who worked in the prison system as a nurse. And so that was kind of how we knew about the positions. Most people in nursing don't think about, when I become a nurse or I want to become a nurse so that I can work in correctional managed healthcare and, help inmates.
Yeah.
It's not your traditional thought process. So unless you've kind of heard of it from other people or someone that's worked in that role, you wouldn't really even know it exists, but it does.
Yeah, I feel like where I grew up in Pennsylvania, there's a lot of prison systems. So it was like a pretty relevant topic to me. But when you talk to other people, it's like, wait, what? Like, why would I want to do that? And just recently, my friend who's a physician, she's now working in the prison system.
Okay.
And
Yes.
actually, a NICU nurse just got her NP and she's now working in the prison system. So maybe it's becoming more popular.
Yeah, it's unconventional, but if you think about it, people do have babies while they're incarcerated, and there is a lot of sickness, and they're human regardless of what they've done, and they need care, and so somebody's got to do it. And so there's nurses, there's doctors, there's lots of different roles for medical people in the prison system. There's dentists, there's mental health. So yeah.
How long were you in the prison system?
I worked there. So I was getting my master's degree in forensic nursing. And I worked there the entire time I was doing that. And so that was about, I guess, a little over 2.5 years total that I worked at the prison.
And that was your favorite one.
Yeah.
That's pretty cool.
Yeah. I mean, to be honest, early in my career, I didn't stay in very many positions long because I hadn't found my passion. I think the one thing I did the longest, which was probably like 10 years, was agency nursing. I worked for the same company for over 10 years, but that was because I could go all over the place and learn different positions and do different things, which I always enjoyed learning and being introduced to new areas and new hospitals and learning new policies and procedures and some other unconventional roles that you can do as an agency nurse.
I love how you worded that with, you didn't find your passion. And the whole point of this podcast to get out and share with everyone is what everyone's individual passion is. Right. So all of those places that you worked, you realize that you haven't found it yet. Do you think that influenced, or like, did you see a lack of education in a lot of those areas? Or like, when did this like light bulb go off for you?
Yeah. So I don't know that I saw a lot of lack of education in the areas. I think it was more that I love to learn. So I guess that might be part of where my passion for education came from, because I like to pass it along, and I like to educate other people as well as learning myself. And it's kind of like, if I don't know, let's look it up together and learn together. And I just, I'm just always looking for ways to improve or, just learn new stuff. But how I really got into it was after I graduated with my master's in forensic nursing, the same school that I went to. Give them a shout out if that's okay. Quinnipiac University in Hamden, Connecticut. They were one of the 3 first schools that even had a forensic nursing program. And I was a second graduating class from there. And they really wanted us to kind of go out and be like pioneers and kind of write grants to create positions for forensic nursing, because it was very new and unknown. But it was in my life, at that time in my life, I was only 24 years old, and I had been, or 26, I had been going to school for a very long time, with little breaks in between. And I kind of wanted to focus on my personal life and meet someone and have children and have a family. So I wasn't really ready to like be a pioneer and put my career like number one only.
Yeah.
So I ended up, they offered me a position at the school to teach in the laboratory, the nursing lab, and as a clinical instructor. That was sort of my first getting my toes wet in teaching and education, and I absolutely loved it. I loved being with the students, and just kind of, especially in clinical, that was my passion, was being hands-on and like doing stuff and being with the patients. And so just watching the light bulbs go off for them, because in some of my nursing education roles, I was able to get students as freshmen and then get them again as like seniors or juniors, and to see the difference in how,
yeah.
Oh yeah, it was amazing. Like the first day as a freshman, or, they're like, oh my God, I don't know how to even talk to the patient. What do I say? I'm afraid to go in the room. And then you get them back later on, and they're just like running into the room, and they just, the growth is amazing. And so it's very rewarding.
And I think that, we talk about education and, the education at the bedside, like you're already a nurse, nursing is forever changing. And you think about, okay, how are we going to implement these new practices? But really, the education is in nursing school. And, something that I remember in our conversation initially was, is nursing for everyone? And you think you're good, like, yes, this is what I want to do. But then you get into the classroom, into the clinicals, and as a student, you may be thinking, oh my gosh, this isn't for me, but what do I do? So that really kind of lands on you as an instructor to maybe recognize that or help to facilitate that decision that maybe.
Correct.
Right?
Yeah. And so as an instructor, that can be a very difficult thing, especially when maybe you as the instructor recognize that this is not for this student and they don't necessarily recognize it in themselves. I've had some students where, I recognize that they don't quite get it. And they're not necessarily safe to take care of patients because they're not quite, getting what they need to learn in order to provide safe care. One of the things that hits home for me, which made education even more of my passion, is that I had a personal experience with my grandmother going into the hospital for a surgery. And it was an elective surgery. I mean, she needed it, but it was volunteer to help better her life.
Okay.
And because of errors from very new or inexperienced or maybe uneducated, I'll never know.
Yeah.
A nurse made a mistake, and it ended up costing my grandmother her life. She had to go back for emergency surgery.
Whoa.
And she didn't come out. And it was something that happened that really was very basic. And so it just feels like, that really should have been avoided, could have been avoided. And I don't know where the breakdown was for this nurse and what happened, but that just made me want to be even more involved in education and making sure, because truly, nursing instructors are one of the defense lines for keeping the public safe from students, people who shouldn't graduate and shouldn't become nurses, because it's not for everybody. You can have all the heart in the world, but if you can't critically think and make, important clinical judgment decisions, then, we have to say, your heart's in the right place, but you don't have the skills needed to be a safe nurse. And that's what's most important. So, we're like the first line of defense. And then, of course, there's the NCLEX exam, which, also helps to, test their competency level. Some people are very book smart and they could pass the NCLEX. Hopefully now with the new NCLEX that's out, that does test a lot more clinical judgment and critical thinking, that maybe that will stop just students who are book smart and can memorize a lot and regurgitate it on an exam. Hopefully this new test will, keep them from getting past that last line of defense.
I have my RNC, and that I'm just thinking when you're talking about I didn't realize the NCLEX is changing or has changed.
Yes.
Yeah, like your RNC, it's very little knowledge, basic knowledge. Like, what is the correct answer? Majority of is everything's correct. You just have to pick the right
best.
Yeah, and it's like understanding pathophysiology, implementing it into the patient, and then making that decision. So I do agree that, that's brilliant. I didn't know that. So I'm happy to hear, because, I think about when I was in nursing school and I had a horrible nursing instructor. She hated me.
I think we all had one, I swear.
Yeah.
And I have one that pops right to my mind immediately.
And she was like, she sat me down on a clinical, on a peds unit, and like, I'm in the pediatric ward, I'm in baby world. So like, to just even think that she almost broke me in that moment, it's like, I'm like, what are you doing? But she just like didn't like me. And she's like, do you even want to be a nurse? Oh, and it was over something really stupid. I was scared. It was in Pennsylvania, and I had like a young girl that had Rocky Mountain spotted fever.
Oh God, that's so rare.
It's so rare. And then you're giving me a hard time because I'm like afraid and I don't understand it. It's just like, it's so crazy to, to think about that. I almost thought, okay, I'm wrong. Yeah. But, yes, she hated me, but she had a conversation with me. I think it was inappropriate, but it does remind me that you can't expect everyone to be nice. Like, this is our education. And also as a bedside nurse, when the students come in to do their shadowing, or their clinicals, and they're paired with us, their instructor goes away.
Right.
So it's up to me to, have to give some feedback. Right. And there are instructors that ask for feedback, but then there are some that don't. So then how do you know how they were on their day? Right.
Exactly. And, a lot of people think like right now, there's such a huge nursing shortage. But the truth of the matter is there's not a nursing shortage. There's a nursing education shortage. So there's lines for students wanting to get into schools. And so, schools are having to turn students away, potential students, because they don't have enough instructors to teach all these students.
Yeah.
So the big issue is that we don't have enough nursing educators. And then we have a lot of nursing educators that don't have a, degree in nursing education. If you think about it, we're one of the only careers that you can have a master's degree in anything. I'm a prime example. I'm guilty. I have a master's degree in forensic nursing, which has nothing to do with education. And I was allowed to teach for years and years and years. And luckily, I've received a lot of feedback from students that I was a good teacher. I tried to mostly stay out of didactic because that wasn't my strong point, and I knew that. And so I just felt I had a duty to kind of stay out of there. I was always told by students, I learned more from you in one term than I have my whole, nursing career so far. You have the patience of a Mother Teresa. Like, because I never scolded my patients in front of, or students in front of patients. I felt that that was very important. You don't do that. Like, you pull them aside. You don't want to kill their confidence. We are one of the only careers that you can have a master's degree in anything. And so it doesn't mean that you're a good teacher. So there can be a lot of faculty that really have no business teaching. They don't want to give out the bad grades because they want to be liked, or they stand up and they just, tell all their stories and experiences and expect students to learn clinical reasoning, critical judgment by that, which is not teaching. And then a lot of faculty who are still death by PowerPoint, and they don't understand, like, the flipped classroom and the new edutainment type of teaching that students, are looking for. And so that is a huge issue, is the just, we have a shortage of nursing educators.
Yeah. And I think, like, I always thought, what would I get my master's in if I went back to school? And I always said, I don't want to be a manager and I don't want to be an educator. But on a travel assignment I had last year, I was actually able to kind of go into like the educator role, because it was a smaller unit. They only had one educator for like maternal child health, but this person did not have a background in NICU. So, she tried her best.
Right.
But when I came on and I was like, why don't we do this? Why don't we have this? They kind of were like, okay, you do it. So I got to be in that role, and it was fulfilling.
Right.
So, because it's nice to share your knowledge and your skills and educate other people to make sure they're doing a safe job. And that's what it comes down to. I think education equals safety. And your example of your grandmother, which I'm so sorry that happened, and thank you for sharing that. But it's reality. Like, a little mistake of just your head somewhere else, or you just don't know and you're afraid to ask, and it can cost someone their life. And, I think that's a big thing that nurses need to understand. We are our own self. Yes, there's doctors. Yes, there's residents, yada, 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 until it gets to us. But we still can make mistakes that impact lives.
One of my most important sort of pieces of advice for students always was, don't ever be afraid to admit what you don't know. The scariest nurse is the one that walks around saying that they know everything and there's nothing they don't know. That's the one you want to run from. That's the one you want to refuse at the bedside, because nursing is you never stop learning in nursing. There's always something new. I mean, practice changes, evidence changes. So there's always things to learn in nursing, and you have to keep that open mind in that career and in that role to keep your patients safe. And so I've always told my students, don't be afraid. If your patient asks you a question, or family member or the doctor, whoever, if they ask you a question and you don't know the answer, the safest, most honest thing to say is, I'm not 100% sure, but I'm going to find out and then come back and let you know. I will get back to you. And then you keep that promise. And then, you come back, and that person's going to respect you 10 times more than if you tried to like BS your way or chat GPT your way through it. If you try to do that and then they're chat GPTing it on the other end or Google it and they realize you said it wrong, you've lost all credibility and you've lost the trust.
You do. And you're 100% right. Like, I have been in those positions, like, I'm not saying I'm not cocky by any means, but I do know a lot about what I do.
Sure.
But there are times that a patient will ask me, well, in this case, like a parent will ask me a question and I'll be like, yeah, it's this. And then I'll be like, wait, hold on. Now might be turned around. Let me go verify this and come back to you. There wasn't any lack of trust or, oh, I don't know if this is the best nurse taking care of my patient. It's respected so much more to be honest and to not fabricate your way through something. And unfortunately, I see that. We overhear other nurses talking to patients or the family, and it's like, it's actually not true, but it's just like to save time. And, we need to definitely be better about that
Yeah.
and, make sure that we educate ourselves so we're educating our patients and their families the appropriate way.
Right. And I think that the first most important person to teach new nurses and nursing students that sort of standard and behavior is their nursing instructors.
Yeah.
If their nursing instructors can't admit what they don't know because they're afraid of not looking smart enough or or students, questioning them or anything like that, if they can't admit what they don't know, a student is never going to learn to admit what they don't know. And
'Cause they're
so
not
we
living
have
that
to pass
cycle.
that on. We have to,
Yeah.
we all have to just be a little bit more humble and realize that nursing is huge. And we've all heard it. Oh, you're a nurse. Can you tell me from your friends, coworkers, just anybody, family, anyone you meet? They all will ask us that. A hairdresser does. So you always ask that question. And we don't know it all. I mean, we go into specialties for a reason because we learn everything in nursing school to the best that we can, but there's no way for us to remember all of that.
Yeah.
And so you learn the most in whatever you go into in that experience and whatever you're exposed to, but there's just no way to, we're not walking medical books is what I basically tell people. And we just have to be humble with that and realize that we're not and be okay with that. And it is okay to admit what we don't know.
And I feel like this conversation has just been amazing. I think we brought a lot of light to education, but we missed the key component of why you're here and working at UWorld and what that is. And why don't just briefly tell me what your position is in UWorld and then what UWorld is.
Sure. I'm the associate director of the nursing education department at UWorld. UWorld is huge. It is a world. They started out as with the USMLE. Our CEO, Dr. Chandra, is a doctor, and he started out with, creating questions for medical students to practice to help them, pass their exams. And he tried to publish that book, and a publisher said, why do we want that? And we don't need that. And so he published it himself, and he created himself his own world. And then his next vertical was nursing in 2015. We've been working on our products for 10 years now. I have a lot of experience with working with some of our competitors and, other test prep companies, which is basically, that is our biggest product. We started out as an NCLEX preparation company. We, created lots of questions for students to practice to take the NCLEX. And we have grown tremendously, even just since I started there. And that was 2.5 years ago. Now we are creating products for faculty to use in the classroom to help teach their nursing students. We're creating 7 courses that have different products within those courses to utilize, lots of videos that are quick bite size, 7 to 10 minutes long, short, I should say, that just kind of give the main points. So, students look in a book and they look in chapters and they're like, oh, my test is on, these 5 chapters. And oh my God, what do I study? So what we've created is sort of the most important points. We've left out statistical data that changes every 2 years or 6 months or 5 years. We left all that out. We just get right to the point and have the most important information there within videos. And then we also have PowerPoints available to them. And then we do quiz questions and practice questions and final exams and all kinds of different products for these faculty to use. So
I love that. Did you bring that to the table? Because that's literally what your passion is and what you stand for. So this is the perfect fit.
No, it was our brilliant CEO, Dr. Chandra's ideas.
Yeah.
Sometimes we change, our direction, on a dime. He'll just come in and say, hey, this is what we're doing now. And he's shift and put everybody on this. And we're like, okay, we're doing this and we're going to get it done. And, he is very successful, and UWorld has been nominated by students for the #1 test prep product
Great.
out there. So, we're not afraid to follow his lead because he's been very successful and he seems to know what he's talking about. And, he respects my boss, Karen's opinion and mine as well, because we do have a lot of experience in testing and education. But yeah, I'm very proud to work for UWorld. Like I said, I've worked for some of our competitors, and the quality that goes into our products is like nothing I've ever seen. And we hear that from students. So it speaks for itself.
Yeah. And this is starting, I mean, NCLEX prep is obviously for student nurses. After you graduate, you have to take that to be able to, be a bedside nurse. But
Right.
now that you're taking that into the classroom, I think that this is going to be something to really change the education and just be able to, I hate to say it that way, but like weed out what's not meant to be,
Yeah.
a little bit. And I think, it's okay to say that, and it's okay to acknowledge that nursing may not be for you. But, I don't want to go down that path. But, I think I wish this would have been available to me
Yeah.
when when I was graduating nursing school, because full disclosure, I did not pass my NCLEX on the first time. I
Yeah.
prepped terribly. I was nervous. I didn't sleep the night before. I took every single question, and then, I took it again, and I'm like, this is so easy because I was able to take a
Yeah.
breath. So,
Prepare and right.
yes,
Right.
I think that having UWorld be able to provide student nurses and then graduate nurses prepare to take their exam. I think that this is something that any new nurse out there listening definitely needs to get on there and utilize
Yeah.
your hard work.
Yeah. The funny thing is, so as you know, I had the flu a few weeks ago, and I went to a walk-in clinic, and it was a nurse practitioner who came in and took care of me. And she saw that I was wearing a UWorld jacket, and she's like, oh, she's like, do you do patient care? And I said, no, I don't do that anymore. I said, I work for UWorld, actually. She goes, oh, I saw your jacket. She's like, I love them. I use them for NCLEX. They are absolutely the best product out there for NCLEX. She's like, I tell everybody, if you're, preparing for NCLEX, to use UWorld because, their questions seemed like they were just right from the test itself. And we try to mimic exactly how the NCLEX writes, how they present, how they, do everything, format, all their stuff, because we want the students to feel like they're getting that real NCLEX experience before they even get in there, so that it's an easy transition when they get in to take the exam. It's like, wow, this looks so familiar. And, and some people even say the NCLEX was easier than UWorld. We've heard that feedback.
That's okay.
Yeah. And so, I have a friend whose daughter is preparing right now, and she actually texted me with that question the other day. She's like, is the NCLEX actually easier than UWorld? I said, well, I've heard that before. And I said, just keep going, and so
you're educating yourself at the end of the day, even if it's a harder question than what the NCLEX is, you're setting yourself up for more of a success.
Absolutely. Yeah.
So to wrap all of this up, I know you've said could give one piece of advice, but I like to end the episodes with just your biggest takeaway, or what you just really want the listeners to take from this.
I think the most important thing is, again, it comes down to education. It is my passion to keep patients safe through education. And if I could speak to all the nursing educators or future nursing educators out there, remind yourself that we don't have to know it all, and do your students a favor and admit when you don't know something, and then just help them find the answer together. And if it starts there, I think that will trickle down into their practice. And then if they become a teacher, they'll remember that, and then they'll practice that way and pass that down to students if they ever teach in the future. And I think it's just so important for nurses to stay humble. It's a very respected career. Nurses are known for having the highest ethics and values. And I think we need to make sure that we continue to behave that way. and show that that is true. And we can admit what we don't know and find the answer, and then continue to, practice safely.
I love that. And I'm so happy you came on here. Thank you. Thank you so much for sharing your wisdom, your knowledge, your education. And I feel like we need to have you back to talk more about this forensic nursing. So
yes, I would love to. Yes, correctional managed healthcare, prison nursing is a whole other topic, and I would love to talk about that if you.
Well, good. Well, thanks again, and I'm sure everyone's going to take so much away from this.
Thank you, Anne.
Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.